So what is medical assistance in dying? So it's a process whereby a physician or a nurse practitioner helps a patient who wants to voluntarily and intentionally end their life involving drugs that can be taken orally or by intravenous. The patient must meet eligibility requirements that are very strict, and they're set out by the federal government. So the change came about that it is now lawful in certain circumstances for a physician to administer medication to end a person's life at his or her informed consent. Medical staff still cannot help assist in a suicide. These are not suicides, these are informed choices by the patient. So it was the Criminal Code Act that was changed. So there's an eligibility criteria that came into effect. There's procedural safeguards. Vancouver Coastal Health has a very specific policy. Our governing bodies have very specific policies for us to follow, standards to follow, all of that. And it is still a criminal offense to assist someone to commit suicide if they are not otherwise eligible. So who is eligible and what is the criteria? This is what the criteria is. They have to be 18 years of age at least. They have to be eligible for publicly funded healthcare services in Canada. They have to request assistance without pressure or influence from anyone else. They have to be capable of informed consent throughout the entire process, right to the very end. They have to have capacity and be able to be of their right mind. They have to have a grievous and irremediable medical condition, illness, or disability, be suffering intolerably from their condition, and be in an advanced state of decline that cannot be reversed, and be at the point where their natural death is reasonably foreseeable. A lot of that's come straight from the policy. So the policy has, of course, been through risk management, legal, all of that. So people are allowed to, as a staff, we need to be sensitive and we need to be objective about addressing requests about medical assistance in dying. We have to make sure that we ourselves know the information and have sufficient information so that the patient gets all the information. If as nurses or physicians we don't have the information, we need to refer the patient to the coordination center so they can get it, as well as the physician. It plays a key role as making sure the patient has all areas of their disease process looked after. And like Dr. May said, the pain control, providing services. Our community, we do lack the overnight care of home and community care, and our caregivers do burn out. Vancouver Coastal Health believes that patients can receive a medically assisted death anywhere. It can happen in the hospital, in their home, wherever they prefer to have it. Some hospitals have said that it's not allowed to happen in their hospitals, like faith-based hospitals. And Vancouver Coastal Health in their policies also said we need to be respectful of conscientious objectors. And if somebody is a conscientious objector, you just let your manager know. You're not expected to participate in this if it's not something that you believe in or want to be a part of. You just let your manager know. The one thing that you still need to do, though, is if a patient chooses this, you still need to help with end-of-life care for the patient. So once the patient has died, you still look after the family, you still look after the body, you do what you would normally do, you just don't have to be part of the procedure. So this is what a conscientious objection is, that you want to be non-participating staff. You just let your manager know, and it should remain private, anonymous, doesn't need to be public knowledge. Your rights should be respected. Staff and provide patients with as much information as you can. And if you don't feel comfortable with that, then you get the people that are comfortable and help provide the information. We don't impose our own beliefs on a person, and we don't require them to justify their decisions or anything. So just being respectful. What do we do when a patient asks for information? So we answer the questions the best we can and what you're comfortable doing. If And if you don't, and even the physicians are allowed to be conscientious objectors as well. So if the physician doesn't want to answer questions, you give the medical assistance in dying pamphlet to the patient, and on the back of that is a coordination center. And the coordination center will answer all the questions and help the patient navigate what their wishes are. So a patient must sign a request form requesting this. They have to be of right mind and meet all that criteria. They have to have 2 independent people sign and witness that they've signed this form, cannot be healthcare workers. They have to meet the criteria. 2 physicians, independent providers, independently assess patients. They come to the same agreement, and they meet the eligibility criteria. Then the patient must wait 10 days for a period of reflection, just so that it can make sure that they aren't having second thoughts. The 10-day period can be shortened on for specific causes up to, and the prescriber and assessors can make that call. And then the provision is given. The very last question before the patient receives the drugs, whichever way they choose, is they have to sign another consent, and they still have to answer all those questions again, so that to make sure that they are still wanting it. So if you have participated or want to participate, or you don't feel comfortable, there's EFAP for nurses to call. If something has happened or you don't feel comfortable, you can debrief with EFAP. Physicians have a special medical number that they can access as well to get support. And then this is what Vancouver Coastal Health offers for support from the Care Coordination Center.